Hashtag USMLE style question on anencephaly, failure of rostral neuropore closure. A 25-year-old woman, gravida 1, para 0, presents for a routine prenatal ultrasound at 18 weeks of gestation. The ultrasound reveals an absence of the fetal forebrain and an open calvarium, with amniotic fluid appearing echogenic. The mother had minimal prenatal care and did not take folic acid supplements. Maternal serum screening shows markedly elevated alpha-fetoprotein, AFP, and increased amniotic fluid volume, polyhydramnios. Which of the following best describes the underlying embryologic defect? A. Failure of the caudal neuropore to close during the 4th week of development. B. Failure of the rostral neuropore to close during the 4th week of development. C. Defective migration of neural crest cells during neurulation. D. Failure of prosencephalon cleavage during the 5th week of development. E. Failure of secondary neurulation affecting the caudal cell mass. Answer B. Failure of the rostral neuropore to close during the 4th week of development. Explanation: this fetus has anencephaly, a severe neural tube defect caused by failure of the rostral cranial neuropore to close by day 25 of embryonic development. Pathophysiology: the forebrain, prosencephalon, fails to develop, leading to absence of the cerebral hemispheres. The calvarium remains open, exposing brain tissue, which subsequently degenerates. Polyhydramnios occurs because the fetus lacks a functional swallowing mechanism. Maternal serum AFP is elevated due to leakage from the exposed neural tissue. Risk factors: folate deficiency, maternal diabetes, teratogens. Ultrasound findings: absent cranial vault, no forebrain structures, polyhydramnios. Incorrect options: A. Failure of the caudal neuropore to close during the 4th week causes spina bifida, not anencephaly. C. Defective migration of neural crest cells during neurulation associated with neurocrestopathies, e.g., Hirschsprung disease, DeGeorge syndrome. D. Failure of prosencephalon cleavage during the 5th week leads to holoprosencephaly, which is a defect in forebrain division, not complete absence of the forebrain. E. Failure of secondary neurulation affecting the caudal cell mass associated with tethered cord syndrome or sacral agenesis, not cranial defects.